Hi, Dr. John Torres here with NBC News. Facebook Live, what I do with this is I explain a couple headlines that have been happening over the last few days, particularly over the weekend, and then I take your questions. So please, if you have questions, send them our way. I get to as many of those as I can. But what I like to do with the headlines is explain the headline and what's going on really behind the headlines, get you a little more information, things you can use, things you can understand a little better than what you typically hear in the minute and a half we have time to do on our news broadcasts. Or in the paper, sometimes we don't get too far into an article and don't have a full understanding of what's going on, so hopefully this can help out a little bit. But again, if you have any questions, please send them our way because I love to answer the questions. You guys always have fantastic ones. But let me start with the headlines. Number one, vaccine. There's been a lot of information about the vaccine and what could possibly be happening with it over the last couple of days. And you might have heard that people are now saying, okay, we might have this vaccine by the end of the year, maybe October, maybe November time frame. There's a lot of speculation as to what might happen here. Now, the experts I talk to, they all uniformly say before it's released to the general public, before it's released to everybody, they're thinking late winter, early springtime of next year. So we're talking February, March, April time frame of next year for a very specific reason, because right now, we're looking at a bunch of trials that are happening, phase 3 trials with a bunch of vaccine manufacturers and developers around the world. As of now, there are around 200 different manufactured or different vaccines that are being looked at. Of those 200, 9 are in phase 3 human trials. Phase 3 is the last of the phases we do before they start seeking approval for them. To break it down completely, 3 are in phase 1, 14 are in phase 2, 9 are in phase 3, out of the 200 plus that are being looked at around the world. Now, the reason this is important is because typically what happens is you go through phase 1 on 10, 20, 30 people, make sure it's safe. Phase 2, you do it on a couple hundred people, make sure it's safe and effective. And then phase 3, you do it on thousands of people. And some of these, they're doing them on 30,000 people. They'll look at them over the next couple of months once they get them injected with the vaccine to, number one, make sure it's safe. They're not having any issues with the vaccine, particularly large issues. And then number two, make sure that it's effective. Now, the problem with the effectiveness, and the reason this takes so long, is because they have to have a certain percentage of coronavirus cases in their environment in order to make sure that the vaccine is actually working. As you can imagine, if somebody gets the vaccine and they go out and about their daily lives and there's no coronavirus cases in their neighborhood, in their area, in their community, then it's hard for researchers to understand, are they not getting coronavirus because there's simply no cases, or are they not getting coronavirus because the vaccine is working so well? So typically what they want to do is they want to have it, and it's a bit counterintuitive to some of us, but they want to have it where there's a big outbreak of coronavirus just to make sure that that vaccine is working like they want it to work. Part of the problem is they're chasing that a little bit because New York, if you remember, March, April time frame, the epicenter of the epicenters, we were calling it. It was a huge epicenter of the whole world. And then what subsequently happened is now the last I saw as far as positivity cases were below 1%. And so it's hard to test a vaccine environment like that. So they'll have to wait until the virus starts making a comeback again, which it'll probably do come fall time frame. And then they can look from there. And so that's one of the issues. The other issue is recruitment. There are people right now that they're having a difficulty recruiting because they're looking at a huge spectrum of adults, typically 18 to 65. Some of these are extending up to age 80. They're looking particularly for ethnic minorities and people with pre-existing medical conditions, so they can go ahead and test them on them as well to make sure it's safe and that it can be effective, and then trying to answer questions. Do older people need a double dose, much like they do with the flu vaccine, to get that immune system response because their immune system gets weakened as they get older, or can we give them the normal dose? These are all questions that need to be answered. But, and this is the big caveat, in the meantime, Dr. Steve Hahn from the FDA is saying, we're looking at what we're doing, we're looking at what we call an emergency use authorization. To give you a little background here, the FDA typically does an approval process. They'll approve something like the vaccine after it goes through these 3 phases of human trials. That's typically done after animal trials. So first animal trials, then you start human trials. You go through these 3 phases, including the large, robust phase 3. Then you analyze data, you give that data over to the FDA, and the FDA looks at it and says, okay, we are now approving this for general population use. That takes years. Typically, on the average, a vaccine takes 11 plus years to develop. The fastest one is the Ebola vaccine. That was 4 years to develop, and it's still essentially in the development phase. They're using it in some places around the world. Well, now comes the coronavirus vaccine. Looks like we're going to get it in probably around a year, maybe a little more than a year. That is record-breaking time for a vaccine. But there's so many people working on it. There's so many resources into it now. And there's new techniques and procedures now that make it safer to make a vaccine now than it was during the time frame when the average time was 11 years for a vaccine. However, getting through that phase 3 trial is critical. But here's what Dr. Hahn is saying as far as the FDA approval process. I talked to Dr. Hahn about a month and a half ago, and he said he's not going to approve it unless the science and the data shows that it's safe and effective. What they do with emergency use authorization, it truly is for emergency use during something like the pandemic, is they say, okay, we're going to put up a bit of a different standard. So instead of having it all those robust trials, making sure it's safe and effective, in this case, what they do is the standard they look at is they look to see if the benefit is more than the risk from it. And what's the risk of getting coronavirus without the vaccine? And so they'll look at this, and what they're typically saying, what they're thinking this one is the emergency use authorization might come out by the end of the year, but if it does, it'll come out for very specific groups. Frontline health workers, essential workers that can't get away from other people who might have COVID-19, and then those with pre-existing conditions that could have severe complications from COVID-19. Part of the concern other experts say is, wait a minute, if we look at pre-existing conditions and those that could have complications from COVID-19, we're looking at about half the population. So do we really want to inoculate or vaccinate half the population with something that hasn't gone through phase 3 trials yet? So what one expert group has come up with is saying, hey, let's have a group of independent experts who can look at all this data and give recommendations based on this without any political pressure or political issues or even the idea that politics might be behind it, to make sure that everything is on the up and up. Let's go ahead and do it with an independent panel. That's being looked at right now. Time will tell which direction they go with that. But again, we're talking earliest, probably November timeframe, December timeframe, latest, probably come summertime, late spring, maybe late winter. We'll see what happens with that. But again, more than likely, it's going to be for certain people, essential workers, healthcare workers, those with pre-existing conditions, and then eventually for the population in general. Now, the other question I get is, how good is this vaccine going to get? Is this going to be a bad vaccine to begin with? And I always tell them, when it comes to this, there will be no such thing as a bad vaccine once it gets this emergency use authorization or approval. There'll just be vaccines that work differently. And by that, I mean that some experts are saying that this first batch of vaccines is basically going to be a vaccine that doesn't necessarily prevent you from getting COVID-19, but it prevents you from getting complications of COVID-19, particularly from dying from it. And so it's still going to be very useful and very helpful. To get that one that prevents COVID-19, that usually takes years of development. And so that's probably the second or third iteration of the vaccine. But this first one doesn't mean it's a bad vaccine. It just means it's a vaccine that works a little bit different. And the example I can give you is the flu vaccine. Even though typically 50 to 60% effectiveness is what we talk about, that's 50 to 60% effectiveness from getting the flu. But what we typically don't talk about is how effective it is at preventing you from having complications or dying from the flu. And that's typically what the flu shot is thought to be useful for. Same thing here with coronavirus vaccine. We think that's going to be the first iteration or two iterations of the vaccine. It's going to be useful to prevent complications, prevent you from dying from coronavirus, and hopefully get us to that herd immunity level we need in order to get things back to normal, get our lives back to at least a near normal. But that's a vaccine. And let me talk a little bit about numbers here. So here in the U.S. right now, 6 million cases, a little over 6 million cases. Unfortunately, 184,000 cases of people dying from coronavirus since the pandemic started. Globally, we've reached 25 million, but certain things have been happening. Number one, India has surpassed U.S. They have got the highest daily total of coronavirus cases, 78,000 cases. Overall, 3.5 million cases. Remember, we're at 6 million. But the other thing you have to remember is India for a while were being looked at as, wow, they're doing a really good job of keeping coronavirus under control. But then coronavirus started hitting their major population centers, and that's why you see their numbers trickle up and moving up very quickly now to the levels they're at now. Expectations are they're going to be even higher. Here in the U.S., numbers look like they're getting under control. Since August 16th, we've had under 50,000 cases. Now we have 37,000 cases from yesterday in the U.S. Those numbers are dropping. But the big concern here is because the numbers are dropping, we might be letting our guard down, having those numbers go back up. There's also a big concern, are we testing less? That way numbers are dropping. Well, it looks like positivity rates are dropping as well, and hospitalizations are dropping. So it's probably a combination of all those factors. But again, numbers are dropping does not mean it's time to let our guard down, because we do know there's going to be this another wave, whether you want to call it the second or third wave, happening come colder weather, October, November timeframe. And that's mainly because we move indoors, we tend to cough and sneeze and have runny noses, which means that we can spread the virus more quickly and more readily that way. So again, remember, still mask up, still social distance, still wash your hands, and if you can, open your windows if it's not too cold outside. And the third one are small gatherings. Now we're looking, and this kind of segues from the last one, now we're looking at small gatherings and how they are probably one of the big drivers behind some of the outbreaks we're seeing. And by small gatherings, we mean it can be 15, 20 people. These are not large gatherings. Typically, weddings, family outings, family get-togethers, those types of situations are causing a drive in some areas of these higher numbers of cases. The reason behind this, they think, is because there are so many of those happening across the country, especially as we start getting towards Labor Day, that families are going to start getting together. What they're saying is, and what I'm saying as well, is be careful with these small gatherings. Number one, keep them as small as possible. As small as you can keep them, to make sure you have an understanding of everybody else's exposure risk, what they've been doing over the last couple of weeks, and how risky that could be to you. On top of that, you want to make sure that you have a way to trace everybody afterwards in case somebody does have a case. You can make sure everybody else is quarantined and taken care of so it doesn't spread much beyond that. But your gathering size should be dependent on the size of the arena you have, of the area you have. Outdoors better than indoors. Outdoors, you can separate people further because you have more space. Indoors, you're going to limit the number because you don't have that much space. And then definitely remember ventilation, open windows. Make sure that your filter in your house, if it's in your house, your filter is MERV, a MERV 13 or higher, because that's going to give you the best filtration rate for keeping coronavirus filtered through there and hopefully getting most of that out of the air. But these are things you can do to try and help out. Number one, remember that those small gatherings are a driving factor behind these higher cases, so just be very, very careful. So again, going over real quick, vaccine, a lot of news in the vaccine about potentially getting this emergency use authorization, and what that means. Global cases continue to rise. We're at 25 million now. India seems to be one of the driving factors at this point, with 78,000 cases reported. Compared to the U.S., we had 37,000 cases. Our numbers are dropping, but that doesn't mean you can let your guard down. In small gatherings, be very careful with them. Certainly want you to have fun. Certainly want you to enjoy family and friends, but make sure you do it in a very safe manner. So now let me see if you have any questions.
Can this virus stay sleeping, quote unquote, in the body, kind of like chicken pox, then later it becomes shingles?
So the question is, can this virus lay dormant in the body? Can it sleep in your body for years and then later on crop back up? The example they're giving is chicken pox. When you get chicken pox as a child, and most of us, if we're old enough, had chicken pox somewhere in our early lives, that chickenpox virus never actually goes away. It hides out in your body, and it particularly hides in what we call the nerve roots, especially along the spine. So it'll hide in the base of the nerves, and then years later, your immune system keeps it at bay for most of your life. Years later, as you start getting older, your immune system drops down a little bit, and that pops out. But instead of popping out as chickenpox, it comes out as shingles. And shingles is essentially chickenpox presenting itself as this rash in the second or third time case presentation. Originally it was chickenpox and then these rashes. We're seeing that at younger ages as well. Now with the varicella vaccine, not seeing it as much. But the question is, can this happen with coronavirus? We don't think it can happen with coronavirus. Obviously, time will tell, mainly because it's a different type of virus. It doesn't tend to live there, and other coronaviruses don't do this. And so it doesn't look like that should happen. It doesn't look like it's something we should particularly be worried about at this time, but we do know that there can be some long-term complications from coronavirus, so that's what we need to be really careful of right now.
Are vaccinations going to be mandatory for COVID-19?
Are vaccinations going to be mandatory? That's a very interesting question, and I don't think anybody knows the answer at this point. Probably vaccinations are going to be mandatory for certain populations. You can imagine if you're a healthcare worker, they're going to say you need to be vaccinated or else you need to wear a gown, mask, shield, gloves the whole time you're at work, regardless whether you're working at the front desk or you're in the back just doing computer work or you're directly taking care of patients, because hospitals need to make sure that they keep their patients safe. And it's very common for right now, if I'm going into a hospital system, if I'm going into a clinic system, I need to check certain vaccinations. Do I have a hepatitis vaccination? Do I have the flu vaccination? And I can imagine coronavirus be added to that as well. I think other populations are going to look at it and say, okay, who are the ones that are most risk for two things? One, getting it themselves. But for some of these workers, even giving it to other people might be more important, as in a hospital setting. Make sure you don't pass it on to other people. And they might say, okay, you're going to have to make a choice. Do you want the vaccination? Or if you're that much against it, we're going to ask you to look for another job. Don't know at this point. But my guess is there's going to be some that are going to be mandatory and others not so much. But remember, we need to get that herd immunity, which some people are saying 50 to 70% of people either had coronavirus and now have sustained antibodies, or have the vaccine in order to get back to normal.
Who exactly are they testing these vaccines on?
So who exactly are they testing the vaccines on? That's a good question. Phase 1 is typically 20 or 30 people, healthy young adults. And that's to look to make sure it's safe and a little bit look to see how effective it is. Phase 2, they expand the spectrum of who they look at, and it's typically adults that are a little bit older, but they're typically healthy adults as well. And that's 200 to 300 people they look at. And phase 3 is where they do the population studies. So typically what they're doing here for some of these 30,000 people, and they look from 18, some are 65, some are even 80. They're looking at that age group, and they want people with multiple medical conditions. They want people across all ethnicities, because basically what they want to do is they want to mimic what's going on in society and take that as their sample and say, we're looking to make sure it's safe and effective in people across the spectrum of society. What they don't have at this point are pediatric cases or pediatric volunteers. And that's for a very good reason. First, they want to make sure it's safe and effective in adults. As you can imagine, especially if you're a parent, you want to make sure that it's safe and effective in adults. Once it is, then they'll start looking at it in children. So it's going to be a little bit delayed to that point. But once they get through the adult phase looking at it, even partway through phase 3, then they can start incorporating children to make sure it's safe and effective for them as well. And so hopefully by the time it gets approved for each population group, it's been tested on each population group. And not even hopefully, that is the standard that we use here in the United States, and should be the standard going forward with this as well.
Do you feel it's important to test everyone for COVID, even those without symptoms?
Do I feel it's important to test everyone without COVID, even those without symptoms? And the answer is no. Part of it is, talking to a lot of experts, they'll say the same thing, that we cannot test ourselves out of this pandemic. We cannot test our way out of this pandemic. Testing is one of the things we use, and I always call it the three-legged stool. There's testing. If somebody turns out positive, there's isolation, and then contact tracing of who they might have been around. That's what it's going to take to get this under control. Now, we've had a testing problem since the beginning for a variety of different reasons. Now we certainly have more tests out there. There's even more coming. There's a new test, a 15-minute test you can get in your office. And it's equivalent saying, should we test everybody for the flu? We had a pandemic, H1N1, back in 2009, did not test everybody, but tested those that make sense to test. And that's people who either have symptoms, or they were in exposure to it, or they're going into an environment where we need to make sure they don't have it. But for the average person who's sitting at home saying, everybody else got tested, I should probably get tested, don't really need to be tested at this point. Just keep an eye on yourself and keep yourself safe. Start getting symptoms, or if you have exposure. If you've been around somebody or an area where you think coronavirus is there, then it might be a good idea to get tested. Part of the reason is because I could get tested today, come back negative, and then tomorrow I get coronavirus. And if I got tested tomorrow, it'd be positive. What we can't do is nobody in any part of the world would ever have the ability to test everybody every day for coronavirus. You can imagine 330 million tests every day for coronavirus. That is just unfeasible. And so what they're doing is selective testing of those who need it at this point. And what the CDC has said is, if you were exposed to it, or your healthcare provider thinks you need it, or the public health authorities think you need it, meaning that if you have an exposure to it, or you're in a situation where you might be passing it on to other people, then get it. Part of that reason, again, is because we do have limited, and we'll always have limited supplies of testing. There's no infinite number of tests out there. So again, not everybody needs to be tested, but we certainly need to do a better job than we're doing right now to get those testing numbers under control, because that's part of how we keep the pandemic under control again. But thank you for your questions. These have been fabulous. Let me go over the headlines briefly again, just to make sure everybody understands those. Vaccines, a lot of news about the vaccines, a potential emergency use authorization coming out before clinical trials are done. Some experts are saying, well, we need to make sure we're doing this correctly, so let's set up an independent panel. that looking at this November, December timeframe, that's about the same time these phase 3 trials will be done. Most experts are also saying for the general population, it looks like late winter, early spring, maybe even into summer before it gets approved for everybody. So that's where we are right now. Global cases, 25 million. India has taken the lead on daily cases. Unfortunately, 78,000 daily cases, or 3.5 million overall cases, but they have just started kind of where we were a few months ago. So most experts think these numbers will climb. Let's hope not. And then here in the U.S., 6 million cases, 184,000 deaths, unfortunately, because of it. But now the daily rate is dropping. Daily rate's now down to 37,000. It's been below 50,000 since August 16th. But doesn't mean we can let our guard down. We need to keep doing those things, what I call the 4 W's. Wear your mask, watch your distance, wash your hands, and in windows, a reminder to open windows, ventilate as best you can to get that fresh outdoor air exchanged in for the indoor air so you can get this virus diluted out and better under control. And in small gatherings, make sure you watch those small gatherings because those are a driving point behind the pandemic, and we need to make sure we get those under control. So if you do have a small gathering, limit the number of people so people can appropriately social distance, wear masks if you're indoors, all those things we know that really help out. But in the meanwhile, for the rest of the week, I hope you, your family, your loved ones, and your community continue to stay happy and continue to stay healthy. Thanks.